This is one of our conference delegates, Naida Izmaylova. Hi, Naida.
Hi.
Can you tell us a little bit more about your background?
My background, I'm a doctor by education, so originally I'm from Russia but live in Ireland for many years.
Now, with a question about the conference, this is not your first time attending this event.
No, it's my third one.
Okay, so the fact that you're coming back tells something, I suppose, positive, right? But can you tell us a little bit more about did you enjoy the conference?
Of course I did. I enjoyed every single time, so that's why I'm here. Like
that's why you're
addicted. I am addicted to the conference of Alexander Per.
Mm-hmm.
Yeah, it's very interesting. I'm delighted to hear and to be involved how he explained about our inner human regulation. So I'm just like sitting on my university desk remembering about everything, how it works in controls, and it's very promising, as I can say, in a treatment of patients.
What exactly do you find promising? Because a lot of people refer to low-dose medicine as homeopathy, which, as we learned today, it's not.
It's not.
But,
it's not.
What makes a difference, do you think? What is the difference for you between homeopathy and low-dose pharmacology?
At least because it's used of our natural bioregulators as a low dose of hormones, neuropeptides, cytokines, and growth factors, at least, which is not contains in a homeopathic remedies, as far as I know. But I'm not a homeopath in my eye. I'm just I'm just a usual allopathic doctor, as I say, conventional doctor.
It's not a trick question. So I suppose for you as a doctor, as a person kind of with scientific background, I'd say, probably publications, probably the preclinical trials.
Yes, and medical evidence, yeah, it is. It is made for me significant. It is affect my mind. I mean, by showing these publications, this medical evidence, how it works, why it works, and comparing to the gold treatment in conventional medicine. That's good.
So that sounds brilliant. Do you personally, as a medical professional, do you see a future of low-dose pharmacology?
Yes, I see.
In everyday medical practice?
Yes, I see, but will be difficult to, like say, to break this barrier, and the reason why, because all doctors educated in a conservative thinking, which they got from the university as well. After the third level, I mean, the first 3 years. We're learning this, what Alexander Per says, but the last 3 years we just treat the symptoms and that's it. We forgotten about everything what was said before. That's why it should be barrier should be broken, and that's it. I think it will be. Yeah, not a long process.
What do you think we as presenters of that method, promoters of that method, what do you think we can do to actually bring it to more medical professionals in Ireland?
Just to bring them to the conference and to organize conference more frequent.
So education is important?
Yeah, it is. It is important part. Education is important part. For doctors, only education, I can say. There is no any advertisement that will work like this one, no.
It's a slow process?
Yes, it is. It should be papers, it should be publications, it should be spread like conference in even allopathic. They should, for example, invite to Alexander Per or other scientific from Guna, just explain about the new approach of medicine, I think.
So that actually sounds, it's great to hear that from a medical professional, from that side. And thank you very much for your opinion, and thank you very much for coming to the conference.
And see you again.
We'll see you again.
See you in Milan. Bye.
This is Wayne Allen. Wayne, would you please introduce yourself and tell us about your background?
Well, I'm a clinical nurse manager in in charge of a busy department preoperative assessment in a big hospital. I also work as a classical homeopath and have an interest in the Guna products as well. Previously I taught for 5 years at the College of Homeopathy in Tralee.